Do you know what to do when your child gets a burn? What you should do when your child gets a burn would depend on how severe the burn is. Simply put, there are 3 levels of burns, and what to do for each of them is gonna be crucial. According to the World Health Organization, 75% of burns in young children are due to liquids, hot water, and steam, while 20% of burns in young children is due to a young child in contact with a hot surface. In this video, we are going to talk about the different causes of burns, the 3 levels of burns such as the 1st degree, 2nd degree, and 3rd degree burns, as well as what to do for each of them. Hi, I am Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Burns in kids. So what are the causes of burns? One example is thermal burns. This raises the temperature of the skin and the tissue underneath. Thermal burns can come from steam, hot water bath, spilled over coffee cups, hot foods, or from cooking liquids. Another cause are radiation burns. This comes from the sun's ultraviolet rays, like sunburn because the skin isn't well protected, or from radiation from an X-ray. Another cause are chemical burns. This can come from swallowing of strong acids or bases, such as drain cleaners or button batteries. It can also come from spilling of chemicals like the bleach onto the skin or eyes. And another cause are electrical burns, wherein the skin comes in contact with an electrical current. It can happen from biting on electrical cords or from sticking those fingers onto electrical outlets. Now we come to the types of burns. The first and the mildest type are the 1st degree or superficial burns. This is limited to the top layer of the skin. Signs and symptoms include redness, pain, and minor swelling. And the top layer does not have any blisters. Healing time can take 3 to 6 days, and the top skin layer can peel off in 1 to 2 days. The next type is a more serious 2nd degree or partial thickness burns. It involves the top layer of the skin and the next layer below it. So signs and symptoms include redness with blisters. There can also be swelling and pain. The blisters might break open and the skin appears wet with bright pink or cherry red color. Healing time varies as to the severity of the burn. It can take 3 weeks or longer. And lastly, full thickness burns are also known as 3rd degree or 4th degree burns are the most serious types. It involves all the layers of the skin with nerve damage as well as also involves the underlying tissue. As to the signs and symptoms, the surface appears dry. It may look waxy white or leathery, brown, or charred. There might be little or no pain because of the nerve damage. Well, in terms of healing time, it depends on the severity of the injury. It may also require skin grafts in which healthy skin from one part of the body is taken and surgically placed over the wound to help the area heal. Now, what should you do? Well, you should get medical help right away for any burn that is other than a superficial type of burn. You should also get medical help right away for a large area such as 2 to 3 inches in diameter. For these burns with large surface area, do not put ice or cold compress over the burn because it might drop your child's temperature. Instead, cover the burn with a clean cloth or a clean towel. You should also get medical help right away if the burn is from a fire, electrical current, from a socket, or from chemicals. You should also get medical help right away if the burn involves the face, scalp, hands, genitals, and also from the skin over the joint. You should also get medical help right away if you think there is infection, such as swelling, if there is pus, and when there is red streaking near the burn. Now, what to do for superficial burns? First off, remove your child from the heat source and take off his clothes right away. Run cool water over the burn. You can also apply cold compress, but do not use ice over the burn as it can make it worse. Also, do not apply grease, butter, powder, or other folk remedies as it can make it worse and increase the risk of infection. What you can do is that you can apply aloe gel or cream a few times a day. You can also give your child acetaminophen such as paracetamol or ibuprofen for pain. Also, keep the area clean. You can cover it with a sterile gauze. Now, what to do for partial thickness and full thickness burns? First off, get medical help right away. And while waiting for medical help, you can do these things. You can keep the child lying down with the burned area raised. You can remove all clothing except those that are stuck to the skin. Do not break any blisters. You can also run cool water over the burn for 3 to 5 minutes, and you can cover it with a clean cloth until help arrives. How about electrical burns? What to do? Well, you should make sure that your child is not in contact with an electrical source before removing him or her because you might also get shocked. Now, for chemical burns, flush your child with running water for 5 minutes or more. If the area of the chemical burn is large, you can use buckets of water, tub, shower, or a garden hose. Do not remove your child's clothing until you have flushed the area. After you have flushed the area for a while, it is okay to remove your child's clothing. For chemical burns to the mouth and eyes, these kids need to be seen by the doctor right away. Hey, if you liked this video, watch my other videos where I teach you about other child health problems.